SMART goals enhance continuing professional development. Let's talk about why SMART goals can be helpful and how to create them. We acknowledge the land on which we work, live, and gather is Treaty 2, 4, 5, 6, 8, and 10 territory, the traditional land of the Cree, Dakota, Lakota, Dene, Nakota, Saulteaux, and homeland of the Métis Nation. By the end of this presentation, you will be able to describe why SMART goals are beneficial, identify where SMART goals are utilized in the CPD cycle, avoid common pitfalls when creating SMART goals, and create your own SMART goals that suit your practice. SMART is a framework for setting well-defined goals that are clear and actionable. Goals that are specific, measurable, attainable, relevant, and time-bound will help to break down your overall objective into more manageable components that can be tracked over time. SMART goals are part of the plan step of the CPD cycle. Once you have identified an area of your practice that your CPD cycle will focus on, SMART goals can help to establish a clear and specific plan as you progress through your cycle. SMART goals can help to keep your CPD cycle from becoming too broad, and they allow you to track your progress as you apply your learning into your day-to-day practice. Taking the time to write a SMART goal will help to guide your learning needs in the learn step, track the actions taken within your practice that can lead to change or improvements in the apply step, and determine if your goal was met and what your next steps are in the evaluate step. So let's break down a SMART goal. First, make your goal specific. Ask yourself what it is you would like to accomplish in your CPD cycle. A specific goal is one that is clear and precise about what you want to achieve. Use action words in your goal to get specific about what you will do. Words like develop, gain, demonstrate, and complete can help provide a focus for your goal. By having a specific goal, you can more easily know what fits within your cycle and what can be noted instead for future projects. For example, while attending a learning session on menopause, a pharmacist noted that additional information on treatment options would be helpful. They determined they want to focus in more specifically on those patients with uncontrolled menopause symptoms. Next, consider how you will measure and track your progress. How will you know that you have accomplished your goal? What you measure should be meaningful to your practice. You could consider measuring your confidence level after an interaction or intervention. You may track the number of interactions you seek out regarding a specific topic, the number of interventions or actionable recommendations made, adaptations to processes or workflow, and other things within your practice. It is recommended to avoid measuring time spent learning, as a goal that focuses only on this will be difficult to apply and measure in day-to-day practice. In the menopause example, the pharmacist decides to identify 8 patients from within their practice that have uncontrolled menopause symptoms and discuss possible treatment considerations with them. Next, your goal should be attainable for you and your practice setting. You may need to break down your goal into smaller pieces and maybe more than one CPD cycle so that you can focus on what is attainable for you at the time. Also consider what barriers you may come across and try to find supports you can access to help you overcome these barriers. This may involve sharing your goal with your colleagues and considering how you will acquire the skills and knowledge you need to achieve your goal. For many pharmacy professionals, a common barrier they identify is time. Time to learn what they need to and time to apply the information into practice. In the menopause example, the pharmacist decides to try and set aside some time dedicated to read and review the resources. They discuss their goal with the pharmacy team and share the question tool with them and ask for their help in adjusting workflow to allow time to talk with the identified patients. These small steps can help to make the goal more easily attainable. Ensure your goal is relevant to you and your practice. Consider how it is meaningful to the work you do and who it will benefit. A relevant goal is linked to a skill or behavior that you need in your role. Consider how achieving the specific measurable goal that you have set will benefit yourself, your patients, your colleagues, or the healthcare system as a whole. Lastly, make sure you choose a time frame that you can complete your goal within. Ensure this time frame is reasonable by considering the time it will take to learn the information you need, as well as the time that you will need to apply the information into practice. If you haven't achieved your goal within this time frame, your cycle is still valid, but this ensures that there is an end date at which you can reflect on your progress and consider the next steps for this or another CPD cycle. Ultimately, the pharmacist decides that their goal for their CPD cycle will be, over the next 6 weeks, I will identify 8 patients from my pharmacy who are experiencing menopause symptoms that are not well controlled. I will use the MQ6 question tool to initiate a conversation with those interested in discussing their symptoms and make recommendations if needed. In this example, a learning activity identified a gap in practice that led to this SMART goal. And with the goal in place, the pharmacist has a clear focus for how they will apply and track changes to their practice and evaluate if the goal was met. Let's look at another example. While preparing for a blood pressure clinic at the community pharmacy, a pharmacy technician identified that to educate patients on proper blood pressure measurements, they needed more information. The technicians started their goal by narrowing down on specifically what they would need to be able to do during the clinic. They determined that it would be important for them to be able to confidently discuss and recommend validated devices to patients and educate them on how and when to take their blood pressure. They noted that they had not had a lot of prior experience educating patients on this topic and rated their confidence level at 6. Through their learning, they wanted to increase their confidence level on this topic to 9. They determined that their goal was attainable because they had the support of the pharmacists and had found many reliable resources to improve their knowledge. They also knew that their goal was relevant because this advice is important for patient health, and being able to provide it efficiently would be important for the clinic workflow. And since the clinic was in 3 weeks, the time frame they had to do their education was already set for them. Ultimately, the pharmacy technician's goal was, by the blood pressure clinic in 3 weeks, I will increase my confidence level from 6 to 9 and be able to efficiently answer questions on the frequency for taking blood pressure measurements, proper blood pressure measurement techniques, and recommend devices that are validated by Hypertension Canada. The relevance and attainability of their goal is not directly written into it, but they have reflected on both and are confident that their goal is both relevant and attainable. In this example, an identified gap led to this SMART goal, and with the goal in place, the technician will be able to proceed through the next steps of their CPD cycle with a clear focus on what they need to learn, how they will apply practice change by tracking and measuring their progress, and determine if their goal was met. For additional support and guidance in writing SMART goals, SCPP has created the SMART Goals Guide, which can be found under Continuing Professional Development on the Competency web pages, or by following this QR code. Thank you for watching, and please reach out to the CAP team if you have any questions or feedback on the program.